Hello friends, Jeanice Mitchell, pelvic health physical therapist, and I'm so excited that you're going to pelvic physical therapy. Here are 10 questions for you to ask. Just a reminder that I'm a physical therapist, but I'm not your physical therapist, and this information doesn't replace evaluation by a qualified healthcare provider. Number 1, your status. So the physical therapist is going to do an evaluation, and different evaluations look different. It all depends on the therapist, and it depends on your symptoms and your history and so many things. We'll actually do, I think, some more videos on the evaluation part. But once they do the evaluation, you want them to tell you your status. So what is the source of your symptoms? What did they find out? What do they think is going on? So make sure that that communication is happening. A lot of times physical therapists will tell you what they're finding and what they're thinking as they're going along in the evaluation. But if for some reason your physical therapist hasn't told you and you're at the end, make sure you ask. Number 2, your goals. So this is so individual, but basically, what are you not able to do now that you want to be able to do? And that could, again, be so many different things. Could it be pain? You're having pain with going to the bathroom. So right now, you're having pain and you want to be able to go to the bathroom without pain. Or let's say running. You used to be a runner, but now you have leakage with running. So you would like to be able to run without leakage. So finding out, the physical therapist should generally ask you what your goals are. And then finding out, hey, physical therapist, do you think I'm going to be able to do X, Y, or Z as a result of physical therapy? So for example, if we said leakage with running, physical therapist, do you think that I'm going to be able to run again without leakage at some point? Number 3, mechanism of injury. So basically, what started this? Why did my symptoms occur? Sometimes your physical therapist will be able to tell you right off the bat, and a lot of times you may even have a good idea about what the source is. So make sure that you're communicating your history and your ideas as well here too. But asking the physical therapist and having that direct dialogue, I think, is very empowering, so you know what caused your symptoms, and that's a very important piece to recovery. Number 4, my pelvic floor muscles. So what did you find when you assessed my pelvic floor muscles? Were they overactive? Were they underactive? Which muscles are involved? Remember, you have 17 different pelvic floor muscles and several layers, and they have different jobs. So what are they doing? What is your endurance like? What is your strength like? How many repetitions can you do? And what positions, were you in? So we have tools and ways that we can actually score and grade a lot of this, and then we document that in your medical record. But I think it's helpful for you as the patient to know some of these things. This is what I started at. This is the goal, and have that open dialogue. The best way to assess, or the most complete way to assess the pelvic floor, is doing an internal vaginal assessment, or sometimes an internal anal assessment. That doesn't mean you have to have an internal assessment. There's still a lot of things that we can do and find out externally. But again, the most complete and accurate assessment is going to be internally. Number 5, my timeline. So how long do you think I'm going to need to be in pelvic physical therapy? Now, this also may be dictated by finances. So if you're a self-pay person, then you can determine how much money you have and how long you can go to physical therapy. If you have insurance, your insurance may dictate how many sessions you get. But generally, at that first visit, the physical therapist is going to give you a ballpark. Hey, I think it's going to take twice a week for 4 weeks, and then we're going to taper down to once a week and then once a month. And by the end of 3 months, I think you'll have met your goals and you'll be independent with your program. Hey, cool, great. But again, that's just an example. So making sure that you have that dialogue with your physical therapist. How long do you think it's going to take for me to achieve my goals? And then you'll have to do an introspective analysis to say, okay, is what that physical therapist is recommending, is that going to work in my life? Whether it be finances, whether it be time, whether it be other factors. And if it's not going to, I would encourage you to have a dialogue with the physical therapist at that time and say, hey, I know you're recommending twice a week for 4 weeks, but I have a $50 copay each visit, and it's really tough for me to make that copay right now. Is there any way I can do once a week and then I can do some stuff at home? And most physical therapists will do anything that we can to help you and to help achieve your goals. So have the conversation. Number 6, my pelvic therapy interventions. So what does an intervention mean? Basically, it means what we're doing with you. So it could be pelvic floor muscle training, it could be hands-on stretching, it could be scar mobilization. We have a lot of tools that we like to use in pelvic floor muscle training. Some of those tools involve something we call surface EMG biofeedback, or there's an ultrasound machine that we can use to kind of help see what your muscles are doing. There's dilators, and there's wands, and there's weights, and again, so many different tools that we can use, but hopefully the physical therapist will volunteer this information and say, hey, I'd like to do X, Y, and Z with you, and this is why I think it's gonna help you. But if they don't say that, then you having the power as a patient to say, hey, what are we gonna be doing and why? Number 7, my therapy team. So if you're going to a little solo private practice where there's just one pelvic physical therapist, generally it's going to be that physical therapist that's working with you, right? But if you're going to a bigger clinic or a bigger hospital setting, I think it's important to understand what the expectations are. So is that physical therapist going to be working with you every visit 100% of the time? Or is that physical therapist going to co-treat with a physical therapist assistant, which are also licensed and trained to help you? Or is that physical therapist only going to do the initial evaluation and then they're going to another clinic and you're going to see a different therapist at this clinic? Or are you going to hop around between different therapists every week, which is not the best case scenario. But again, I think having that conversation and knowing what to expect and what your therapy team, who your therapy team is going to consist of, will be helpful and also set your expectations up. Number 8, my home program. So basically, great, we did all this stuff in the clinic, but what do I need to do at home? Do I need to Kegel? Do I need to work on relaxing? Do I need to work on perineal massage or stretching or whatever it is? So asking the physical therapist, okay, what do I need to do at home? How often do I need to do it? Is it every day? Is it twice a day? What does my home program look like? And most physical therapists are going to be very cognizant of the fact that most people are busy, right? And if we give you a list of 25 exercises, which all may be very good exercises to do, it might be a little overwhelming, and especially if we say do this 3 times a day. Well, who has time to do 25 exercises 3 times a day? Not most people. So again, having that conversation with the physical therapist, what does my home program look like? And then if it doesn't seem like it's going to fit with your lifestyle, you having the courage to say to your therapist, hey, I don't think I'm going to be able to do this consistently. Is there any way we could cut out some of this? Or, hey, I can give you like 5 minutes a day at the end of my day, every day. So if you have 5 minutes every day, what would be the most important things that you want me to do? And I think that's sometimes a helpful reminder, because I know as myself as a physical therapist, I've given people loads and loads of things that probably, they couldn't fit into their life. And if you can't fit it into your life, you're more likely to just say, I'm not going to do any of it, versus if you can find a manageable piece of the key things that we want you to do, then and integrating that into your life, and then you see that you're successful, and then we can gradually, slowly modify and advance as needed. So ask. My equipment is number 9. So basically, is there any equipment that the therapist is recommending that you get at home? If you have insurance, occasionally insurances will cover some of this equipment, but most of the time, equipment that you need at home is going to be self-pay. But The therapist will likely have some relationships where they can get you discounts, and they're going to be cognizant. If money is an issue, most therapists are going to be very sensitive to that and say, okay, well, this is what I want you to use, but you could do it with this, or here's a discount code, or I know this vendor that has a sale, or whatever. So basically, having that conversation. Some of the things that I love for people to work with at home are electrical stimulation, biofeedback. I love using dilators and wands and pelvic weights. Now, of course, the same person is not going to be using all of these, and this is by no means a recommendation for you. So make sure that you don't take this as medical advice, but basically the therapist will help to tailor what you need based on what your evaluation showed and what your symptoms are and what your goals are. Number 10, my healthcare team. So as a pelvic physical therapist, we frequently work with other providers, whether they be specialists like a urogynecologist or a tailbone specialist or a pelvic pain specialist or a urologist. And then we also work with mental health providers and professionals. So depending on what your diagnosis is and what things you have going on will determine whether we think that some other providers might be helpful to help achieve your goals. And so just be open to that, and I think it's a great question to dialogue and discuss with your pelvic physical therapist. Okay, so now you're empowered with your 10 questions to ask your pelvic physical therapist. By no means is this an all-inclusive list, so feel free to ask other questions, but I hope this gave you a baseline of some questions to ask and some expectations of communication with you and your physical therapist. I hope you enjoyed this video, found it helpful. Please share it. It makes my heart just filled with joy to reach more people. I appreciate you. Thank you. Bye.